Damien. Hope you can stay with us, Commissioner. What time do you have to leave today? 11?
Good morning, everyone. I believe we have Steve Monahan available at 11 to talk workers' comp, and I will sit in silence as he talks till I have to get off, so I can stick around for a little bit.
Okay, so we're going to start with Damien to talk about the workers' comp, and we'll talk some more at 11. I do want to put a priority on that. I'm hopeful that the administration is okay with it and that we can get it out right away. If they are, I don't think there's going to be much complication to it, and the sunset date is looming for the 15th of January. So Damien, why don't you walk us through what we did last year on the presumption, and then we'll move back to UI with the commissioner, and we'll go to Steve Monahan at 11.
Okay. So this is looking back at Act 150 from last year, which provided the department with two different things. The first was administrative flexibility to adopt procedures, to extend deadlines, or temporarily or amend or waive specific requirements for workers' compensation to address the realities of the pandemic. And then it provided guidance for the commissioner, or the requirement that the commissioner also establish a procedure to transition claims impacted by the COVID-19 emergency back to the pre-existing rules within 45 days after whenever the state of emergency terminates, and then to post all of any guidance or procedures that were adopted on the website. So this was more giving the department legal authorization to take the steps it needed to make sure the system continued to function in a time period when meeting in person or going to see your doctor were not always possible within the time periods provided under the law. The next piece here was a presumption of compensability, where we basically set up two different presumptions. The first was for frontline workers, and I'll get to who that includes in a moment. It provided that disability or death resulting from COVID-19, so this is illness or death resulting from COVID-19, is presumed to be compensable for purposes of workers' compensation if a frontline worker received a positive laboratory test or diagnosis of COVID-19 from a licensed healthcare provider. And the dates are between March 1 and January 15th of 2021. So as you can see, we're very quickly running up on the end of that period. So that's one thing that you need to consider extending. The elevated risk of COVID-19 here refers to, is important for the frontline workers. So it meant someone who performs a job that requires regular physical contact with known sources of COVID-19, or regular physical or close contact with patients, inmates in a correctional facility, residents of a residential care or long-term care facility, or members of the public in the course of employment. And close contact is having to interact with individuals within 6 feet. And then the frontline workers were defined to include firefighters, law enforcement officers, emergency medical personnel, including volunteer EMTs, and the firefighter definition includes volunteer firefighters, workers in healthcare facilities, correctional officers, workers in long-term care and residential care facilities, child care providers, and this is an old one. These are child care providers who were providing child care to the children of frontline workers early in the pandemic. The question that came up in September was whether to extend this to school teachers and child care providers as we went back. And the determination that was made was that the presumption in subsection B of this would give them sufficient protection unless conditions really changed. And then home healthcare workers or personal care attendants, workers in morgues, funeral establishments, or crematory facilities, and then any other worker performing services that the commissioner determines place the worker at a similarly elevated risk of being exposed to COVID-19 as the other occupations. So this gives the Commissioner of Labor flexibility if there's an emerging risk within a specific occupation to make the determination that they should be entitled to the higher presumption. And so that presumption basically says that if you're a worker in one of those professions who faces that elevated risk, and then you test positive for COVID-19, it's presumed to be work-related unless it's demonstrated by a preponderance of the evidence that it's not work-related. And that burden shifts to the employer and the insurance provider at that step in the process. The next is for all other.
Can you just say a little bit about how that works in the workers' comp system in terms of the importance of presumption in an area like this?
Right. So typically the burden on workers' compensation is on the worker to demonstrate that the injury occurred at work. The problem with COVID-19 is because of community spread of the virus. Although your primary risk might be at your workplace, you could also potentially contract the virus through contact with someone at the grocery store or some other community setting like that outside of work. And so it would be very, very difficult, if not impossible, for a regular employee to be able to prove exactly where they contracted the virus. And so by providing this presumption, you're enabling these employees who are working in higher risk professions to obtain workers' compensation benefits, which include wage replacement and healthcare benefits in relation to a COVID-19 diagnosis without having to prove that they contracted the virus at work, which could be very difficult for them. And so this is basically shifting that burden off the worker so that they can get insurance benefits, but it does still allow the employer and their insurance carrier to demonstrate that it's not work-related. For example, if there's documented evidence that the individual was present at a so-called super spreader event or something like that, that might be that might demonstrate that they didn't get it at work. If the timing of their diagnosis corresponds with the time that they were at that event. So does that clarify things?
Yeah, I hope so. I was doing that a little way of background, and also the employer might be able to show that nobody else in the workplace has contracted COVID and they have a very safe workplace and follow all these protocols. So it would be a factual determination, but the starting point would be in favor of the worker.
Right, and we'll talk in just a moment about ways that the employer can overcome these presumptions.
Okay.
And that's in subsection C, if I remember correctly. For non-frontline workers, again, illness or death from COVID-19 is presumed to be compensable if the employee receives a positive diagnosis between April 1 and January 15th, 2021. So the dates are slightly different here, if you'll just bear with me. The frontline workers from March 1 and January 15th. The non-frontline workers, it's April 1 and January 15th. And that had to do with some of the guidelines for workplaces and relative risks, which we kind of wrestled with during the last biennium and settled on this April 1 date, because at that point there were guidelines out for employers and we were starting to address the virus in the workplace. And then importantly, not more than 14 days prior to the date on which the employee is tested or examined, the employee had to have had either documented occupational exposure to an individual with COVID-19 or performed services at a residence or facility with one or more residents or employees who were present at the time the services were performed and had COVID-19 or tested positive for COVID-19 within 14 days after the services were performed. And so this is basically, you have to have had some sort of documented exposure or potential exposure in the course of employment in order for this presumption to apply. And this is different from frontline workers who may have come into contact with someone who is asymptomatic, or may have come into contact potentially with multiple COVID-19 patients in the course of their work, whether they know that or not, depending on whether the individuals are asymptomatic or symptomatic. And then, again, that's a presumption that is rebuttable by the employer. And so the presumption in subsection A, as I mentioned, can be overcome if it's shown by a preponderance of the evidence. So this is 51% of the evidence indicates that the disease was caused by a non-employment connected risk factor or exposure. And then for subsection B, the non-frontline workers, the employer either needs to show that it was caused by a non-employment connected risk or exposure, or at the time the employee was potentially exposed to COVID-19, the employee's place of employment was in compliance with the relevant COVID-19 guidance issued during that time period. So for the first 20 days, that's the guidance issued by the US CDC, and then the Vermont Department of Health and any similar local or municipal guidance. And then after April 20th, it's the Restart Vermont WorkSafe guidance, which is issued by the Agency of Commerce and Community Development in consultation with the Department of Health and other authorities. And so this basically allows an employer to say, it's not likely that they got sick at work because we are complying with all of the safeguards that have been set out for us to protect our employees from transmission. And then at that point, the burden shifts back to the employee to demonstrate that they did contract the virus at work. And again, the last language here is that the commissioner would not be required to initiate rulemaking in relation to any guidance issued or procedure adopted in relation to this section. And this is just to prevent us from getting into a 6-month rulemaking process in the middle of a rapidly developing pandemic. And then in section 3, the unless we take action, these two sections will be repealed on the 15th, which is, I believe, Friday. With that in mind, and given the amount of time it takes to move things from the Senate to the House, I would suggest that anything you do to extend this deadline, notwithstand 1 VSA 214, and apply retroactively to the 15th so that there isn't a lapse here where different standards apply.
So let me ask you, I hear you on that. Let me ask you a question on section 1. That's the general section to give flexibility to the commissioner, which he had exercised even before we passed this act in certain regards. Is that in jeopardy of sunsetting as well?
Yeah, both of those sections are set to sunset. So
it's not just a presumption, it's also just the general authority to, in terms of getting to the doctor on time within the rule or the procedures or rules they presently had or had before COVID. You couldn't make an appointment for one reason or another. So that's why we gave them that authority. And that authority, at least by statute, would sunset on January 15th as well, if we don't pass this bill.
Right. There are 4 dates. The sunset dates for the 2 sections are both January 15th. And then the end date for the presumptions, even without the sunset, the guidance is set up so it runs through January 15th. So we need to change those dates as well, which
So we just got the bill. Did it make the changes in the underlying statute as well as the sunset date?
it did not. That was an oversight on my part. And it will need to be amended anyway to add the 1 VSA 214 language.
Okay.
So I can make those changes.
Okay. We may want those by tomorrow, depending upon what the commissioner has to say.
Yeah, I can have those
Senator
very
Clarkson.
quickly for you.
Senator Clarkson.
So even if we move quickly on this, we won't have legislative action to the governor until probably the end of next week. And given that this sunsets this Friday, is there any way, Michael Harrington, and I don't know, but it strikes me this is one option, that the governor could add in an executive order the extension of this for 1 month until there's a legislative extension?
We'll
I
hear
honestly-
from the commissioner and from Stephen Monahan shortly. We'll ask that question and
That
we'll figure it out.
Yeah, I think the department did take action without legislative authorization early in the pandemic. But it's one important thing to note is that they requested the legislative authorization. And I agree with this because the legislative authorization means that they're not acting contrary to the statute. Arguably, if the department waives a certain requirement or changes a certain deadline and the statute specifically provides otherwise, they're acting contrary to law because they don't have that flexibility in the existing statutes. What Section 1 did is give them that flexibility. Early in the pandemic, they took this action and we went ahead and grandfathered in because it was the right thing to do to address the pandemic. But I would recommend acting quickly and making it retroactive to January 15th. And just again, basically saying that if they continue this administrative flexibility after Friday through departmental action by making it retroactively effective, I think we're essentially grandfathering that in so that it'll stand up to any potential challenge. That would be my recommendation in terms of giving them the legal support they need to take whatever actions. And I don't know, Steve could speak better to the sorts of flexibility that they've got in place right now and the issues that they're addressing.
Okay. Something we have to grapple with for sure. Figure out what's the safest way. Senator Rahm.
This is probably something you all went over as a committee last year, but I'm just curious with the kind of rudimentary information we have about COVID-19, is there any allowances or sort of flexibility for people who feel particularly symptomatic, like they have COVID-19 but don't have a positive test? And what's the flexibility on the back end in terms of how little we know about the ongoing effects of COVID-19 for their continued financial support?
Okay, thank you, Senator Rahm. We're going to save that question and the other question because we want to talk to the commissioner on the UI stuff in the 40 minutes he has left. And the last half hour, we have the state's most expert person in workers' comp to guide us through some of those questions. Why don't, well, there was one more section left in the bill, I think. Was that just the sunset date? I can't, Damien? You were walking us through the bill.
Yeah.
Sure. Sorry, I muted myself for a moment. The last section was the report back from the Department of Financial Regulation
Right.
on whether you could create a special fund to reimburse workers' compensation insurers and intermunicipal associations like the League of Cities and Towns for COVID-19 related workers' comp costs. And that was due on December 15th, I think, or maybe earlier.
I think they did it really early.
Oh,
It was
August 15th.
August
Yeah.
15th.
And they wrote a really extensive report, probably more than we bargained for, but we'll get to that at some point. It's not relevant to the issue at hand. So let's move on. Thank you, Damien. Let's move on to Commissioner Harrington. I think you heard most of our discussion this morning in like the last 15, 20 minutes before we went on the floor, where obviously there's a lot we need to be caught up on what's been happening with UI, but we're most concerned at this point is maybe not as much as with workers' comp, but getting ahead of the deadline coming up on some of the substantive changes we made in, I think it was Act 91, which is that comprehensive COVID response bill from the spring. Can you just launch into, sort of the list of changes we made back then from normal statutory requirements, and if there are any ones that you think shouldn't continue, given the fact that the virus has continued?
Sure. Thank you, Mr. Chair. For the record, Michael Harrington, Commissioner of Vermont Department of Labor. A special welcome to Senator Rahm. Good to have you on the committee, and look forward to working with you over this session. With regards to the act, I know you reviewed it prior to me coming onto the meeting. The biggest change, I think we would all agree, was twofold. One, the allowable reasons for someone to remove themselves from the workforce, and that ranged from everything to needing to quarantine, being instructed by a healthcare official to stay home in quarantine, testing positive for the virus. If they, due to the governor's restrictions, if their business needed to close, or if they lost childcare options. Also included the need to stay home to take care of a loved one who may be at risk due to a medical condition. So you went through those, but that pretty much is the range of flexibilities which allowed the department to process claims and allow individuals to select those as a reason for leaving the workforce, hopefully temporarily, and to be eligible for unemployment insurance. One specific caveat in there, which I think was a nice idea at the time, and I think no one knew back in March and April how broad and how deep this situation would run, and what the impact would be on the Department of Labor and the Unemployment Insurance Division. We to date have processed over 120,000 initial claims. We've issued out over $1 billion in benefits to Vermonters. At the height, we were processing somewhere around 97 weekly claims. Now we're down to about 25,000. So it has subsided some, but to put it in perspective, prior to COVID-19, we were processing 4,000 weekly claims. So we are still, 4 or 5 times more than we were then. The one caveat in there was a lot of the rules regarding eligibility were essentially temporary until and if a federal program was established. And so the department has done its best, obviously, given the volume, that should someone be deemed eligible under the Pandemic Unemployment Assistance Compensation Program, or PUA, that they be moved out of traditional UI and into the PUA program. That was one piece that was in the bill, that this was really meant originally as a holdover or a bridge until federal support was provided. But there was not necessarily a mass way to auto unenroll the people who had become eligible because of this act and automatically enroll them in the PUA program, which also provides benefits for these same reasons. So that may be one area we want to tackle in this bill, although I think we've done at least the best job we think we can in identifying whether, if someone is made eligible or should be eligible under a different federal program, that they are moved over.
Can I ask you a question on that?
Yes, sir.
Because I guess I wasn't aware or focused on that. So does that mean we've been spending a lot of trust fund dollars where we could have been using PUA dollars?
Potentially. I think it really depends on, again, as these programs have come about, there has been increasing or lack thereof in the beginning federal guidance on who can be eligible for the programs, and then new guidance has come out. So yes, there is the potential that this act did make eligible people to receive trust fund dollars who may have been eligible under PUA. When the department is made aware of those claims, we do move people into other programs, which creates an entirely different administrative problem of unenrolling, overpay, putting people in overpayment in one program to pay back in another program, and vice versa. But there is the potential that people were made eligible under this act who could have eventually been made eligible under PUA. I think Cameron could probably speak more to that. Director Wood.
Is there any chance we can recover some of that money to the trust fund and get the feds to pay us back?
Likely not, unless we enroll those people. And the hardest part has been identifying those people. So we made people eligible within the system. However, we have very little in the way of tracking the reason they came in through the door. And so we made that assumption early on to remove the able and available clause that would prevent people from coming in the door, saying, but for COVID-19, these individuals are likely able and available. And we've, suspended other provisions as well in order to more timely process claims, so we didn't end up like many of the other states with 4 to 6 month backlogs. So we do and have the ability and have been moving people into PUA as we come across those. We just don't have a mass way to identify that population and automatically enroll them. So it literally is a one by one.
I thought the PUA was mostly to take care of people who were not traditionally in the system and didn't pay into the fund in terms of, sole proprietors, hair salons, those kinds of folks, to get them some income guarantee during this period. I didn't realize that PUA was also for people who voluntarily quit for personal reasons like quarantining or childcare. Though the liberalization we did in that act, I didn't know that PUA came along and could have picked up those people as well. Was I mistaken in that?
So yes, the original intention of PUA is for self-employed, independent contractors, sole proprietors, but there is a clause there that says, and any other individuals not deemed eligible for regular unemployment insurance. And so there is, through the eligibility certification in PUA, someone does have to identify each week what their reason is for filing. And it does include about 10 questions, I believe, of COVID, what PUA considers COVID qualifying events.
So I guess we'll talk a little bit more to Cameron. I mean, I understand all the administrative challenges your department has had, but it does seem like if there had been a quick and easy way to move a lot of the people who, by virtue of our law last year, became eligible for regular unemployment and put them in the PUA pot, our trust fund might have a lot more money in it today.
Yeah, again, it was, when we contemplated this bill, when this committee contemplated this bill,
There was
you
no
know,
PUA.
we were looking at probably, 10,000 people potentially claiming unemployment, and we wanted to expand it to include eligibility for self-employed individuals to some extent. When we reached over 100,000 claims, that became much more challenging.
Okay. So just you've sort of gone through some of the changes we made last year. Can you target specifically any, I mean, the most simplistic way, and I know we have some time and it probably won't be this simplistic, but the most simplistic way would just be to extend the sunset. Substantively within that bill of Act 91, what changes is the administration asking for? I'm not talking about your new ideas in terms of rate relief, just whether we missed a date because the virus lasted so much longer than we all thought.
Yeah, I think the part I didn't get into, and just for other members, you probably know this, but we will have Cameron Wood, the director of UI, and Matthew Barowitz, our chief economist, on and available tomorrow. So we can ask more detailed questions. But the piece I didn't mention, which I think does create some consternation for us, or again, was good in theory, much harder in practice, was the employer relief. And so again, as Damien mentioned, the act allowed for up to 8 weeks of employer relief if they had to temporarily close or temporarily lay an individual off. The commissioner was given authority to extend that relief. And so we have systematically suspended that relief as the governor extends the state of emergency. But the other provision that's in there is that the requirement that an employer must then hire these individuals back to receive that relief. And certainly, again, with the number of claims, we did not have the ability to track whether an employer, a specific employer hired a specific employee back to the same role or job. So I think our recommendation at this point would be that we have essentially treated every claim that came in 2020 as a COVID related claim, unless it was very clearly identified that it was not COVID related. And so for the most part, most employers will experience charge relief during the 2020 year, especially if it was a layoff that occurred between March and December. I think where we need to then have some conversations is how do we want to systematically transition off that relief, because more and more layoffs at this point, I think, while there's this balance of trying to identify, is a layoff due to COVID or is a layoff due to an economic downturn, which unfortunately is a result of COVID-19. But I think the act, when it was created, was really specifically meant to address a layoff that occurred due to a government restriction, due to a closure of an industry, or due to something directly related to a COVID-19 situation. whether it be an outbreak or something along those lines. So now we're into situations where employers are saying, listen, because of COVID-19, my business is not the same as it was before in terms of revenue, and so I have to lay people off. I think the question becomes, is that a COVID related separation, or is it an economic separation? And because at some point we will need to start reactivating the appropriate charging for claims. And I think, that's probably coming sooner rather than later when we need to do that. A good example, and Cameron could probably share this tomorrow too, is coming into the winter season. As many of you know, traditionally in Vermont, it's a high season for unemployment because the granite sheds and construction industries lay people off seasonally. And so at that point, if we took a large construction employer, how do you determine whether or not the 60 or 70% of their workforce that they laid off was due to COVID-19 or due to a traditional seasonal layoff? One comes with charges and the other one does not. And so, that's where it has been increasingly more difficult at this point to separate those two types of circumstances.
So you're essentially saying that during 2020, not a single employer has had a chargeable event against any layoff?
No, I'm just saying that majority of those, so unless they determine that the employee quit without cause, or there was a separation that they could clearly identify was not COVID related, and there have been. So it's not 100%, but I think all of us would agree that a majority of the layoffs, when we're looking at going from a situation of 4,000 claimants prior to COVID-19 and now being at 25,000 claimants, a majority of those new claimants were very closely related to some type of COVID circumstance. Again, we just don't have the ability to sift through, at one point what was 75, 50,000, 40,000 claims and adjudicate all those cases or audit all those businesses. But we have had some charging, but again, because of the volume and because of the nature of the circumstance, determining whether it's COVID related or an economic downturn, that is where it becomes quite difficult.
So I just want to be clear, the section that you're concerned with about it can only, the chargeability can be waived for up to 8 weeks unless in the discretion of the commissioner. It sounds like in virtually all the cases, the discretion of the commissioner has been granted to go beyond 8 weeks of non-chargeability. And then the further concern you have is that the employer has to also offer a job back to the person who's laid off. And that sounds like that has not been enforced. So you want to get rid of that provision.
Correct. I think, from the charge relief perspective, heading into 2021, we are in a much better position now to sort those types of claims that may be COVID qualifying for charge relief versus economic downturn. So I was more or less just raising that situation as a consideration for the committee, for your own knowledge and information. I think the piece where the recommendation we would have is that we strike from the bill that there was a requirement to rehire that employee back after that period.
I guess we want to talk about this. This is not an insignificant request in that there could be a lot of workers out there that want to go back to work. I'm just not 100%. I'm sure I'm following that, for pretextual reasons or whatever, the employer doesn't want them back and they would otherwise be eligible for unemployment. I don't want to see those people not only lose the opportunity to go back to work, but also potentially lose their unemployment. And also, that's a classic case where the employer should be charged, and they're just using it as a way to hire somebody different
Yeah.
than the one who had been there. So I
Yeah,
think
and I certainly recognize that. I think and so I'm happy to have that conversation and try to work through that. What we have seen is that there are a number of businesses, obviously predominantly in the food service industry that closed in March and April, that never reopened or are still under some type of capacity restriction, or were only able to reopen at a certain, level. And so, in those cases, those individuals would likely, still be laid off due to a COVID qualifying event. Although there may not be a restriction on the business, there just isn't the business. There aren't enough people going out to eat out now as there were before. So again, that's where, there is really no very clear line in the sand to determine. And even when we have broached this question with the U.S. Department of Labor, they are also unclear in terms of a clear definition between a COVID qualifying event versus an economic downturn. And that, that's where we're going to have to sift through this and figure out who falls into what category. And we've already started some.
Yeah, and I don't, speaking for myself, I don't have any problem with the issue of waiving the chargeability. I just don't want an unintended consequence of somebody
Yes.
having an opportunity to go back to work and not exercising it. That person, if we hadn't had COVID, would probably still be on the job. And if the job now becomes available, should they be the first person to be looked at in terms of rehiring? So, okay. So that's the one area. Again, I'm not holding you to this because I know it's more complicated than I'm making it out to be, but if we're just looking at changing the sunset date, that would be the one area you would like to talk about some more. The other qualifying factors and the chargeability factors look as good as they were when we first put it through March 31st.
Yeah, I think I would be interested in just hearing the conversation today, having that conversation with Cameron, both offline, but then tomorrow with the committee about also, whether or not the committee has an interest in continuing those qualifying events. I think, some of those probably still hold true. And the question, I think, really is, do all of those provisions hold true in terms of eligibility requirements? How many of those could be sunsetted and picked up by PUA? So we could move maybe more people over to PUA. I will say we've moved a lot of people over to PUA. So I don't want you to think that hasn't happened. It just hasn't happened in a mass transition. And then I think the other question we have to just talk about is, when we're looking at the continuation of this bill and pushing the sunset date out, how far out do we want to go? And I think that's another question. But I also see that there are a couple hands up.
Okay. Very complicated stuff. Senator Clarkson.
So thank you. I mean, I think it's hard to talk about an economic downturn that isn't initiated by COVID. I mean, so we know public health equals economic health. So I think that's going to be a very hard one for us to differentiate. I guess my question is, I guess I'm unclear. I know we have 11 more weeks of UI extension that the feds have granted, but what's the extension on PUA? I'm forgetting.
Happy to answer that. So the easiest thing to remember is for most people in PUA and on the emergency unemployment compensation, the PEUC, which is part of the regular UI series. And we have a graphic online that I can send you so you can see that. Everything was extended by 11 weeks. So for most people, if they exhausted prior to or on December 26th, they got additional 11 weeks that takes them through March, I believe it's March 13th, the week ending March 13th. for people who, this is where it gets a little convoluted, but relatively straightforward. If someone came in the door in these programs after January 1st, let's say someone came in the door today or next week, in order to help them maximize as many of those 11 weeks as possible, there is an extension of until April 10th for those individuals. So regardless, it's either 11 weeks or till April 10th, whichever comes first.
Thank you.
Did somebody else have a hand up? Senator Brock.
There may not be time to go through this in any depth today, but I'm curious as to what the experience has been about fraud in unemployment. Pennsylvania's reported a significant uptake in fraudulent schemes and phishing to obtain identities to use for PUA fraud. Colorado has reported similar activity. I'm wondering, what have you seen, if anything, in Vermont in unemployment fraud? One. Two, what measures or steps have been taken to prevent fraud generally, both in unemployment and in workers' comp, as a result or as part of what you're doing with the pandemic? And then lastly, we talked last year about situations involving unemployment fraud in which the only penalty that individuals got was a reduction in their ability to file based on number of weeks for unemployment assistance, but that the criminal penalties were entirely gone. And the question that I think we should ask this year is whether or not some criminal penalties for particularly egregious frauds in unemployment should be added. So that's kind of a broad list, and maybe if you could just address the fraud at a high level of what you've seen, and we can come back to the other at some point later on when we have more time.
Sure. So fraud has been a problem. However, for the Senator Rahm's sake, we've gone over this prior, but there are essentially two types of fraud in the UI system. There's claimant fraud, where an actual individual comes into the system, they misrepresent a material fact in their own case that makes them eligible for benefits. So maybe they say that they were fired, but they really quit. That's a pretty common example. But the other piece that Vermont didn't really have to deal with a lot prior to COVID was this, what they call imposter fraud or identity theft fraud. And so what the country has seen and Vermont has seen is individuals who had had their identity stolen prior to COVID-19 through some maybe major national or international data breach. The would-be hackers held on to that information for the right moment and then sold that information when the right moment arose, which was the pandemic. And so we have seen a number of Vermonters whose identities were used to create a false unemployment claim. And what has made this exceptionally hard for all states to track is that it's essentially someone who has all the right details of the individual. They're just not the individual. So they have a social security number, they have a date of birth, they have a mailing address. In some cases, they actually have not only the license number, but a photo of the person's license that may have been uploaded into a profile somewhere in a system at one point in time. So the state of Vermont has taken a lot of significant steps. We have a fraud team that reviews all new claims that come in, and they highlight suspicious claims for review. We also send our initial claims and our weekly claims through a third-party validation process. And we recently signed on to the National Association for State Workforce Agencies. Their Integrity Center was sanctioned by the U.S. Department of Labor as a partner with states for fraud detection and mitigation. And we just recently signed on with them, as many other states are doing, again, to implement fraud detection. There's a lot of work done on the front end for ID validation. So we also cross-reference, again, it's not perfect depending on what the information the fraudster has, but we do cross-reference all initial claims across the against the DMV records that we have as an initial check. We also cross-reference against Social Security Administration. The biggest value for us has actually been the fact that our system is so old that a lot of information is sent by paper to the address on file, which is the correct address, which means the correct person receives the information from the Department of Labor, and it's an immediate flag for that individual to contact the department and say, you know, I just received an unemployment insurance determination from the department, but I didn't actually file. And as soon as we receive that, we are able to shut the claim down, and we refer fraudulent claims to local and federal law enforcement agencies. To your comment, Senator Brock, in terms of scale, like many things, Vermont is on a very different scale than other states. So other states have seen hundreds of thousands of fraudulent claims. I would say we're in the thousands to maybe 10,000 suspicious claims, not actually proven fraudulent claims. So again, on a different scale, but prior to COVID-19, we saw anywhere from 1 to 5 fraudulent, imposter claims in a given year. So we're on a much different trajectory now. But there's a lot of steps being put in place, both at the national, federal level, and also at the state level. But it is increasingly hard to track these individuals down. To your comment about certainly the imposter fraud can result in criminal action, but when we talk about claimant fraud, the authority or ability for the state to take up criminal action against a claimant was removed many years back. So there really are two avenues. One is putting that individual in overpayment, and we can even go as far as going through a collections process if they don't pay that overpayment back. But also they can receive an administrative penalty on top of that. But also, like you said, the penalty weeks. So essentially we typically issue 1 penalty week for every 1 week of fraudulent filing. So if someone filed for 5 weeks fraudulently, they typically receive a 5-week suspension in terms of their inability to file. And I think what is likely to be a conversation both in the House and the Senate this year is whether or not there should be a limit on how many weeks and also how long those penalty weeks stay in place. So what we saw for what the pandemic showed us was that there were a number of people out there who may have been found to have defrauded the UI system, and they received a number of penalty weeks, but then they never went back to filing. So those penalty weeks remained on their profile until the pandemic came back around. And in some cases, these people had not filed for benefits in 5, 7, 10 years, and still had penalty weeks on their profile. So I do know there is interest by others in the House looking to limit not only the number of penalty weeks, but how long penalty weeks can remain on an individual's record. I'm not sure the department has a position on that right now, other than to say, this really is our only mechanism to deter fraudsters, is the overpayment and the penalty week amount. And I certainly would hope that we don't do something that gives us even less teeth than we already have.
Okay.
Well, I remember that one of the issues that we discussed in the last session, there were several really egregious cases, including one that amounted to over $100,000 for an employee who did things like fabricate employment in order to collect money. And we had no method to go after that person criminally. And I wonder what the department's position would be that in those particularly egregious cases to bring back criminal penalties.
Personally, I think I'm with you in that, cases where it is very clear fraud and, something that is so egregious, like the situation you recommended, I think we should explore that as an option, and have a conversation around that. I think there's a very different between someone who, again, it's all on a scale, but clearly this person went into it with knowingly defrauding the system to the tune of hundreds of thousands of dollars and over many. And I think that's the issue we run into, is that some people have made a living out of defrauding the system, and I think that's not what the system is there for. So,
Thank you.
I'm sorry. So I just wanted to comment. We can look at this issue again as we go forward, but I think there are a bunch of bigger substantive changes, and this may be one of them, that we're going to have to look at beyond the sunset date here. And we need to keep those separate, because we are going to be looking at things like freezes and benefit changes and those kinds of things. But in order to not bump up too closely to the March 31st sunset date, we need to focus on the legislation that was put in today and where we're going to tweak what passed last spring, other than extend the sunset date to be more compatible with what has happened with the virus being ongoing. So, sorry.
And just for the committee, just a reminder that I do have the
I
governor's.
was going to say your witching hour is coming up. There's a press conference that the commissioner has to be on at 11. So thank you very much for that. We'll have you back tomorrow.
Sounds
and
good.
we'll move on for the next half hour to Steve Monahan. If he's around. Steve,
I
are you
do
there?
see him on, so I will pass it off to Steve as soon as he comes online here.
Hello, I'll get my, can you hear me?
Yes, we can
Yes.
hear you. And now
I was on another call.
now we can see you. Okay. Hello, Steve. Long time no see.
Yes, good morning. Hope you're all well.
Okay, why don't you introduce yourself, and why don't you jump right into, did you hear the discussion this morning with Damien?
Yeah, I got in on at least part of it when I heard you
Okay.
walking through that.
You're aware of the issue. I guess we have two key sections of the bill: the authority for greater discretion, and then the presumption section. And we missed the mark, I think, assuming one agrees with the policy of how long we should keep it in place for, by setting it at January 15th. So we're looking, I know I had conversations with the commissioner. I don't know what the smoke was, white or black, but I know that he was talking to the fifth floor as to whether you guys are on board with a simple continuation of the policies.
Yes. For the record, my name's Steve Monahan. I am Director of Workers' Compensation and Safety for the Vermont Department of Labor. And I can tell you that my recommendation was that we seek an extension at least to the end of the fiscal year. And I believe the administration has adopted that position. And it was, I wouldn't necessarily, I think, frankly, by August and September, we had only seen 100 first reports of injury related to COVID, 100 or so. And most of those were simply reflecting the possibility of exposure. They didn't involve positive tests or a diagnosis. But this fall, that number pretty much exploded. We're well over 500 now. at least 550. A large number of those still are exposure only, but a lot more positive cases. So, we appeared to have been going along well, and then we weren't.
Okay, can you explain to the committee what you mean by they were only exposure cases? Someone put a claim in even though they weren't sick?
Yes. Or because if an employer learned that an employee was exposed to someone who was positive, whether the employer would file a first report of injury. And then they don't always do that, but generally they would note it. For example, a police officer would respond to a domestic dispute. The people involved in the dispute told the police officer that they were both positive. He would report that to his commander, and they would file a first report of injury. And they would be taking the steps like quarantining and that type of thing. But in the 14-day period, the police officer would stay home, quarantine, not have any symptoms, often get tested and turn up negative. And at that point, the claim would be denied because there wasn't any injury. So that's it. So yes, pulling up my numbers here. I know you can see me, but I have this up in front of me. Yeah, so we have at this point, as of Monday, we'd received 558 first reports of injury. 31 of those were accepted outright. 14 of those are being paid without prejudice. Another 13 really are being paid without prejudice. I know 2 of these actually aren't COVID claims. They're persons who had a reaction to the vaccination, and that would be, in many instances, compensable. We have, for some reason, 212 cases where no claim was made, no medical bill was submitted, and no acceptance or denial was submitted by the insurer. So we're watching those too to see if something pops up.
What happens if someone there's a first claim of injury made and the person doesn't go back to work for 2 weeks if they're feeling healthy and asymptomatic? Are they entitled to any workers' compensation for lost wages during that period?
No, if they don't have a positive test or are not diagnosed with COVID, they're not entitled to workers' compensation. There has to be an injury or illness related to work. They, in some cases, the employers are continuing to pay them either under the employer policy or under the family paid leave provisions of the original CARES Act, which has now been extended. Or in some cases, they are actually eligible because of changes you made for unemployment during that period of time if they're not otherwise getting paid leave or being continued. And I can tell you that I know of a number of cases where in the workers' comp where there is a positive test, but for the first 2 weeks, the employer continues to pay the individual, and the insurance company, it's a compensable claim, but the insurance company can take credit for those payments by the employer during that period. But if there is no positive test and no diagnosis, they're not eligible for any workers' compensation.
Right. Okay. Including any medical following during that 2 week period, seeing the doctor or anything like that?
That's correct. Now they're not being charged. Individuals aren't paying for tests. Shouldn't be there either. They're picked up either by their health insurance or picked up some other way. Those tests are only paid for by workers' comp if there's a positive test or diagnosis.
Senator Clarkson.
Steve, it's good to see you. Would you be kind enough to remind me what you mean by, I know I should know this by this time, but paid without prejudice? I get accepted, so I assume accepted means accepted and paid, but what's paid without prejudice?
Paid without prejudice is the insurance company. Normally, they have to accept or deny a claim within 21 days. But they can notify people that they're going to commence payment of lost time or medical bills, while they continue to research, in which case rules, they can continue to do that, although we require that after 90 days, they either affirmatively accept or deny the claim. But the individual is getting paid benefits. Normally it's either medical only or believe that it will be a short-term period of indemnity benefits. So they advance those, the person returns to work, the claim hasn't been officially accepted or denied, but people move on until there's an additional claim or there's an allegation of permanency.
So where does the prejudice fit in? That they are moving, that they're moving ahead without
formally accepting the claim.
Without formally accepting.
Because once, if they advance payment and they don't tell us they're doing it without prejudice, we treat that as they are accepting this claim. And what that means is that in order to stop benefits, they have the burden of proving that it wasn't. If you pay without prejudice, if there is ultimately a dispute, the burden remains on the injured worker to demonstrate that it was in fact work-related, caused by work.
Thanks.
Senator Rahm.
So I had this question earlier, but is there a separate possibility that they could receive a COVID diagnosis from a doctor or a kind of adjacent acute respiratory illness without a COVID test? And the other question I have is, are travel nurses and per diem healthcare workers eligible for workers' comp if they're being paid a per diem at the hospital and they get infected?
The answer to the first question is yes. We accept a positive test or a physician's diagnosis. Yes, traveling nurses are eligible for workers' compensation. It's either owed by the entity that pays them as traveling nurses or by the healthcare facility where they're working.
Do you have two questions? The numbers, if you could forward those numbers to Nathan, the sheets you had of the two, and also they didn't seem to quite add up. I could tell to.
I didn't cover all the categories.
Okay, so I wanted to know what the other categories were, and also, have there been any serious cases? I know we're after all small and big cases, but has anybody gotten really sick and used this presumption like we did with firefighters in other airborne diseases where there have been claims where people went to the hospital, for instance?
I'm trying to track down how many of these might involve hospitalization. I don't have a firm number on that at the moment. They do not, for the most part, appear to have that. I am concerned that even mild cases, people may actually no longer be contagious and are able to go back to work, but continue to have ill health effects is what a lot of the medical studies that we're reading.
About long-term impacts. Here.
Right, and that is a major concern, and that would be something that, if it was a workers' comp claim, then they might be eligible for a permanent impairment.
So we may not know for a while.
But we won't. But we are trying to track that. What I have is we're We created a spreadsheet. People are entering information as we becomes available. It's not, we don't have any other way to track it. So
Senator Clarkson.
So speaking of tracking, Steve, are we tracking by sector so that we can see if there are certain sectors that are not, where the situation at work isn't well, where they aren't protecting their workers better than,
we are
I can't formulate the question.
We are attempting to try to determine claims or exposure by occupational category.
Right.
Fortunately, the information we're getting or what people seem to be completing as the code, we haven't been able to match up with any known occupational code. It's not clear whether they're using, it's not something we normally collect because we don't have the capability.
Well,
we've been trying to track it, but not everybody seems to be using it. It's not like they're all using NAICS or all using the standard occupational code, although some of them claim they are. They just don't seem to match with what we have. I can tell you, looking at employers, we have a large number of relatively large correctional officers. Well, I'm going in part by, for a long time, if the listed insurer was PMA, which is actually the entity that handles claims for the state of Vermont, we're able to determine those are correctional officers or mental health workers or healthcare providers. A lot of nursing home claims, League of Cities and Towns, we have police, fire, and ambulance. We actually have a few claims made by grocery store employees, smaller retail outlets, but for the most part, they're falling within the first line presumption. And I don't know, I think I shared with the committee last year my explanation of how the presumptions work. I don't know if you all still have that, but I could.
Yeah, why don't you could do that briefly now. That would be good.
Well, there are certain criteria you have to meet: positive tests, close contact, and then one of those demonstrated occupations. That's the first, what I'm calling the first line presumption level that's laid out in section A, I guess. And there, the insurer's only defense is demonstrating by a preponderance of evidence that you actually got it someplace else, which means they have to pursue and do some form of contact tracing, figure out where you've been, or determine that no one else in that facility has COVID, so you couldn't. The second,
Frozen. Help is on the way, correct?
Steve, you're frozen.
I don't know that he can do anything about it. What's the protocol?
I think the protocol is patience.
Oh, okay.
I think protocol is patience for a moment, and then we will. I don't have his cell, or I would text him.
Without a witness. He's being very patient, I think. He looks like he's very patient. Looks like he's
Well,
in church.
There he goes.
He's gone altogether now.
Oh, you're right. Yikes.
The only trick I know for ongoing issues is just turning your video off. Often helps you keep the sound if you have connection issues.
My guess is he will be back in a second. Let me just see if I.
What if we do? What we do has nothing to do with his thing, right?
Yeah, it's localized to his internet. So that's typically the source of the problem is instability in the local network.
Damien, can you speak up a little bit?
I'm sorry, my
Damien?
microphone was out of the way.
Damien?
It's yes, ma'am.
Do you have his cell phone? Are you able to text him? And I don't have his cell phone.
I don't either, unfortunately. But I think at this point we have to wait for him to reestablish a connection and try to log back in. So hopefully it's just a moment or two.
Okay, I think it's a good education for Nathan that it might make sense that for anybody who is testifying that we have all their contact information.
Yeah.
So we can immediately send out the alert to that person because it's possible he doesn't even know that he maybe still be talking for all we know.
Right. No, you're right. That's a good point. That we need cell phone contact so we can text them and let them know what's happening.
He's back.
Okay, welcome back.
I apologize. I don't know what happened. My internet connection disappeared.
Okay, so you were talking about you're about to move on to the second class.
Yeah, the second level, the insurer has more defenses. It can demonstrate that the employer is in full compliance with all of the guidance and requirements and training requirements. But as I said, that's not just something they can say, oh, we did, here's our written policy. We have to have evidence that it's actually implemented, that all your employees early on set up a VOSHA training that all employees had to take before returning to work and sign off. And the employer was supposed to maintain those. So if they're following that, they can provide that written proof to us, along with other evidence that they've got mask requirements, they've got separation, other types.
Who's in the second class of claims?
Everybody who's not named
Okay.
in the first one, and there is a catch-all in the first one that we haven't had to really apply. We've been waiting, looking, but for the most part, even if you weren't named, people have, if they've actually had a positive test, they've generally been covered anyway, because we haven't been submitted. The insurer hasn't provided sufficient evidence to establish that the entity was in full compliance anyway.
Okay. But before I get to you, Senator Rahm, have there been any contested cases that have gone to hearing or on this at this point?
No cases have gone to hearing. A couple of cases have gone to informal conference, where the staff has directed, after reviewing the evidence, directed that they be paid. There are cases where there has been a denial and the claimant has not contested that denial. But nothing, we may have a couple coming up, but nothing at the moment that has gone or even been requested to go to formal hearing.
Okay, and in the first group that get the full presumption, there was talk about adding educators, as you recall, either last year or during the summer. I can't remember.
It was during the summer, yes.
And you, I think you opposed that. And what have you been watching that group in terms of whether they're up to the same category as first responders in any way?
Yeah, I believe what our position was, I thought the catch-all provision would, and this second level would allow us to treat them as a frontline worker if necessary. We've had very few, if any, claims from school employees.
Okay. Senator Rahm.
Just kind of a new person question about the details of workers' comp. Are there certain limitations based on medical opinion around a particular condition or illness? And for something like this, are there cutoffs right now for how long someone can receive workers' comp for COVID-19 related symptoms?
Well, answering the second question first, there are no cutoffs. For as long as you are disabled from working because of a work-related injury or illness, you're eligible for workers' comp. If you return to work, full-time, your temporary total benefits stop because you're being paid wages. If you return to a light duty or less full-time, you most likely are eligible for temporary partial, which will make up some of the difference between what your wages were before and workers' comp. And benefits on those temporary indemnity benefits continue until you're at what's called medical end result, which is essentially this is as good as you're going to get. And at that point, an evaluation of permanency is done. You can be permanent partial, and that's an expert medical opinion using the American Medical Association 5th edition evaluation of what impaired function you have to your whole person. As a result, it's not occupational specific, and that gets broken out into a number of weeks of benefits. Or if you're permanent total, your benefits continue on indefinitely, but after 330 weeks, an employer can demonstrate that you have full work capacity and they could seek to cut it off then. It doesn't happen very often. It perhaps should happen more often because I think what we know, and from a different project, federal grant I've been working with called the Retain Grant, we know that an essential part of many people's well-being is working, and having a job actually improves their overall health as well as their overall mental well-being.
So could you just tell the committee, refresh our memory as to what the weekly benefit amounts are, and if there's a cap? I think there's a cap at 150% of the average weekly wage as to what somebody could get.
Right, I don't have the numbers right in front of me. Generally speaking, a worker gets 2/3 of their average weekly wage averaged over the 26 weeks prior to their injury. Certain weeks aren't counted. If the employer closed for a period of time, we
A
don't.
lot of detail. I just want the people to get, this is a
They're subject to a minimum, which is 50% of the statewide average weekly wage or 90% of the individual's average weekly wage over those 26 weeks. And a maximum, which is 150% of the statewide average weekly wage. And the statewide average weekly wage is something calculated usually by our labor market information group, looking at the overall change in the wage rate of all employees. It generally always goes up. And all benefits get adjusted July 1, but to increase, we call it a COLA. It's not really a cost of living, but it's based on the percent change in the statewide average weekly wage.
Okay.
Currently, the maximum, I don't have the exact number, I can get that to you, but it's around $1,500 a week.
Great. Sounds right. Senator Rahm?
I'm just curious, maybe this also came up last year, because this isn't like hurting your back, this is contagious to your significant other or other people in your household. Is there any consideration for you being asymptomatic and contracting COVID at work, but passing it on to a spouse or household member?
Not in workers' compensation.
Okay. Does that show up somewhere else?
It may be grounds for a civil suit. that's not anything we would have. You'd have to show some form of negligence on the part of the employer permitting that. And the ability to sue, even for your spouse to sue the employer, is limited in general tort law. But yes, that there isn't anything in workers' comp that compensates for the possible exposure of your spouse or children or other people living with you.
Okay. So going back, you probably heard Damien's comments at the end about the changes we may have to do to the bill as introduced, which I just think was changing the sunset date. So there's something to deal with retroactivity, he suggested, and changing the dates within the statute from last year as well, as opposed to just on the sunset date, because there's reference to January 15th in several places. And the retroactivity. Can you be in touch with Damien today to work with him on that language? Assuming
Yes.
you're still in support of that. So
right, and I do agree. What you pass will have to be retroactive. What I can tell you is that you did, and was encouraged. You had give us that general grant of authority to address this. I had made changes which I believe were supportable under the statute. They weren't challenged, and I had meetings with stakeholders before I made some of those changes. There were some that might come up to the line or possibly go over, so I appreciate the legislation that granted that.
we appreciate your work.
We will, on the 15th, technically these presumptions will end. And there'll be a period of time where it switches back and the worker has the burden of proof. But if you make it retroactive, I think we can smooth that out. What we did initially, workers had the burden of proof. You didn't, Act 85 wasn't actually passed and signed until July, I think. But it was retroactive to March 1. And I ordered all the insurers to go back and review all the claims and, accept any or submit proof that they could demonstrate that it was some other cause, that the insurer could do that. And that's what we might have to do again. But if insurers know that, in fact, it's likely to be extended, they'll probably continue to function under the existing statute.
Yeah, I would assume they would, but I guess we could put a paragraph of intent in there that might help you make some arguments with the insurance company if they want to, rely on this specific date. This is not going to work in your favor because it's going to come back and be retroactive anyhow. So I don't know if you can talk to Damien about that, if we want to come up with a paragraph or something in the intent section on going forward for claims after January 15th. We're right up about 11:30. Senator Clarkson. You're muted.
I'm trying to be so good. Just before you leave us, Steve, I'm just curious, as we begin to compare COVID versus non-COVID, how many workers' comp claims sort of on average are there a year that successfully or that go through? I mean, we're looking at now over 600 if you add the 100 claims and the 558.
Right. Well, prior to COVID, we would receive, and it had been because of work of things like VOSHA, an employer paying attention to what it was costing them. We had been steadily moving down. The last couple of years, we've been around 16,000 first reports of injury. That was all prior to COVID. This year, overall, claims are considerably lower than that because a lot of people just aren't working. We're probably only going to see maybe 12,000 or so overall, including the COVID claims. Generally speaking, as I said, a lot of those are the 16,000 are generally preemptive or medical only. The worker doesn't necessarily miss time. He sees a doctor, he gets treated, returns to work within 3 days.
So do you have an average then? If you on average in a year, you have 16,000 claims, that's a lot. What's the average time that they're out of work?
I wish I could tell you that.
Okay. It would be interesting. It would be interesting to know that. I mean, just so we have a
yes,
notion.
it would. And if I get a data system that allows me to make that determination, I'll be trumpeting it. Senator Sirotkin has heard my lament before, but
Well, we
we're
have
working towards it. I got moved to the back burden with some of the UI crisis, but we're
Right.
back up again, working towards getting a proposal out for bid again.
Great. Yes, we're gonna need it. Thank you.
There's a lot we could do with data if we could capture it, track it, and make decisions.
Yeah.
Okay, it's a good stopping point. I hope you might be available tomorrow. I think we're probably, I don't want to push things too fast here, but we might be ready to vote a version of this tomorrow. It'd be good if you were around, if questions come up.
Yes.
It sounds like we've got things covered on this one.
I can tell you I'm currently available until 10, and then
That's fine.
from
Wish
noon
30.
noon to 2, and 3 to 4. I've got lots of meetings tomorrow. But
If you could join us, let's say, it might be good to join us at 8:30 tomorrow morning. And Damien may give you a call in terms of drafting to make sure everything's fine with you, and we might be able to vote tomorrow.
Yeah, what
And
I'll
we'll
do
hope-
is
yeah.
send you the language in a couple hours, Steve, and
okay.
just let you get a quick review of it. Let me know if you see any problems. And then, Mr. Chair, once it's been edited, I'll send it over to you.
Okay,
Right.
Do you want me to send to the whole committee tonight or
Please.
just to you first? Okay.
please send it to the whole committee. Yep.
And
That'd be
we'll Nathan will send me a link for tomorrow at 8:30.
Yes.
Thank you.
Thank you very much, everyone. We'll see some of you this afternoon.
Yeah, and see some of you at 12:15.
12:15.
Nathan, is the link going to be the same every day for each meeting? Or are you sending out a new link every day?
It'll be a new link every day.
Okay. And okay. And okay.
Bye, everyone.
Goodbye.